Developmentally supportive care. Developmentally supportive care is commonly used in hospital nurseries and means providing care that supports the development of young babies. It's especially important for babies who have immature or stressed nervous systems. It includes 3 important positioning principles that you can also use at home: flexion, midline, and containment. Like developmentally supportive care, flexion, midline, and containment may be big, unfamiliar words to you, but they describe things that may be familiar and that you might already have your own words for. Let's go through them one at a time. Flexion means forward bending. In the womb, babies are in a small space, which places the baby into flexion, like this. After birth, being in flexed positions helps babies feel safe, stay calm, and also is good for their joints and motor development. It can also help an irritable baby to get more calm or organized. Midline means helping the baby bring his or her arms and legs together towards the center or midline of their body. This is good for their joints and development and puts their hands in a position where they can soothe themselves more easily. They don't need to be in this position all the time, but it is a good position for them to be in for at least some time every day and may help distressed babies get calm. Right after birth, some babies will keep a flexed midline position without any help, but after the first few days, most babies will need something to contain them, to keep them in that partly flexed, hands in the middle position, which brings us to the 3rd principle, containment. Containment means using positioning strategies to help contain the baby, giving the baby something he or she can move his or her arms and legs against, just the way that before birth the fetus was contained by the womb. Even as adults, a lot of us like a feeling of containment. Others don't need it. What about you? Do you like to pull the covers tight around you or have a heavy quilt on to sleep? Do you find comfort in the feeling of a big bear hug or having a blanket wrapped tight around you? These are examples of ways that we adults can give ourselves a feeling of containment. There are lots of ways that you can provide that calming containment for a baby. In the nursery, where babies are monitored by machines and nurses 24 hours a day, we use positioning devices as well as bundling to provide containment. However, rolls and other positioning devices are not recommended for use at home, where there isn't 24-hour monitoring, because if the baby or the positioning devices move, they could accidentally block the baby's breathing. At home, there are lots of different ways the parents provide containment for their babies. You can do it with your own body. During breastfeeding, for example, many of the common holds naturally provide the baby with lots of containment. Wearing your baby in a sling, snuggly, or baby wrap is another way to provide that feeling of containment, which can help a baby feel calm and secure. Bundling or swaddling, with flexion and midline in mind, is another way to provide containment. In many cultures around the world, including Canada, people have been wearing babies and have used bundling or swaddling to care for their babies for hundreds and hundreds of years, maybe longer. Currently, most public health agencies across Canada are recommending to not bundle babies for sleep specifically due to safety concerns. However, there are times that bundling can be extremely helpful, especially for babies who were born early, are going through withdrawal, or who have trouble eating, sleeping, or staying calm for any reason. Please watch the video When and How to Bundle Your Baby for information on the risks and benefits, a demonstration of how to bundle as safely as possible, and options for safest sleep. Using the principles of flexion, midline, and containment can really help give young infants a sense of safety, security, and comfort as they get used to life outside of the womb. But also remember, as babies grow, they don't need to be in flexed, midline, and contained positions all the time. It's also important for them to have some time when they're awake and content to play on their tummy every day, to move their bodies, and to explore other positions and activities.